Hello, everyone, and welcome to the Master of Public Health Online Programs Student Spotlight webinar presented by the Keck School of Medicine at the University of Southern California. My name is Kiana Carter. I am an enrollment advisor for the Master of Public Health Online Program, and I'd like to thank you for taking time out of your busy schedule to join us today. Before we begin, let's review what you can expect during the presentation. To cut down on background noise, please mute your phone lines as not to disturb the presenters. If you have any questions for our speakers, please type them into the Q&A box in the lower right-hand corner of your screen and hit send. Please feel free to enter your questions as you think of them, and we'll answer as many as time allows at the end of the presentation. A copy of this recording and slide presentation will be available shortly after. Now here's a quick look at what we'll be covering. First, our program director, Dr. Kumar, will share some information about her background and the Keck School of Medicine of USC. Then we'll hear from our students, Kate McAvoy and Genevieve Kincaid. Lastly, we will end the presentation with a brief Q&A session. So again, please type your questions in the Q&A box as you think of them. Also, don't forget to follow us on Twitter at USC Online MPH and on Instagram at USC MPH Online. Now, let's begin. Hello, Dr. Kumar. Thank you for joining us today.
Hello, and thank you, everyone, for joining us. We're very excited to have you here with us today to learn more about the wonderful work that our students and alums do and what this program is about. So just a quick background, a little bit about myself. So I direct the Online Master of Public Health program, and I'm also faculty here in the department. I specialize in the area of global health and really looking at monitoring and evaluation of global health programs. Whether they're having the impact that they intend to have and how the accountability is as far as where is money going and is it being used for the populations that we like to serve, that we're intending to serve. I teach classes in global health leadership as well as global health ethics and have worked kind of all over the globe. I've been very lucky to work in different spaces of the world, and I'm excited particularly about today's presentation to share. You'll hear from our students who are presenting about their work and their humanitarian work in different parts of the world. So a little bit about the program itself. The online MPH program is based within the Keck School of Medicine at USC, and specifically within the Department of Preventive Medicine. Our department has over 100 faculty who all specialize in different aspects of public health and do research and teaching in this area. And we work together within kind of 6 broad divisions in terms of global health and disease prevention, biostatistics, epidemiology, environmental health, health behavior, and we really have a diverse group of faculty doing research and courses in their diverse areas. We look forward to welcoming more students, and without further ado, I will turn it over to our first presenter, Kate McAvoy.
Hello, everyone. My name is Kate McAvoy. I am class of 2015, and I have a short presentation that gives you kind of an idea of the things that I've accomplished and projects I've worked on during my master's and since graduating. Sorry, having a technical difficulty. Okay. So here is the overall picture where I've been. So in 2013, I was working in the Gaza Strip on an orthopedic surgery project, which is currently a war zone, so in a conflict area. In 2016, I was afforded the ability to go to Colombia and Ecuador, and in Colombia, we focused our project on training local women to become health promoters in their community, as well as a family planning program for young adolescents. And in Ecuador, we primarily focus on providing primary health care to the indigenous communities. More recently, in 2018, I was in Uganda for about 2 months and focused on sort of an introduction for me to refugee health and capacity building, and then moved on to Bangladesh, where I was there for 4 months. And I put the question up here, what do you do when 700,000 people show up at your door? And I say that because we need to sometimes understand in the humanitarian context the important role of the community health worker, what it takes to create a community health worker, what is a community health worker. Sometimes it's not just about having highly skilled people there, but having people that are highly skilled that are able to train maybe non-licensed people or train lay people to do very important life-saving tasks. And it's really about saving as many lives, or what is giving back to the greatest need to the population as a whole. So that's just a little bit of an overall picture. To start off talking about one of my first experiences during my master's program was a really important trip in the Gaza Strip. And this diagram here I found on Relief Web, and it just gives you kind of a picture of what life is like in the Gaza Strip. So we have 2 million people, very small area, so highly densely populated, and it is an area of ongoing conflict where people are living in poor socioeconomic status and conditions that are unlivable. So here I just have some photos for you to see, and just so you can get an idea. So we have an x-ray here, and on the left you can see where there's a bar and some pins, and right above that is a bullet. And if you look closely, there's all shrapnel. And so these are things that even if the conflict were to end tomorrow, these are ailments that people will have to live with for the rest of their lives. The picture below that is the picture from the OR. We have many children here that suffer from birth defects and birth defects of the musculoskeletal system. So one of the goals that this surgeon that I was working with really wanted to focus on was how can we improve the lives of the children in this community. And to the right, you see a picture of an apartment building, and it's just so we can kind of think about what our own living situation is like and what their living situation is like. Because really, to be able to give back to a community, you really need to understand what does their daily life look like, right? So what are their needs? So the surgeon had visited the Gaza Strip and found that there was a need. There was a lot of children that had some physical disabilities that he was able to fix and provide follow-up care for. So we had a team of 2 nurses, 2 registered nurses, 1 surgeon, 1 OR nurse, 1 vet tech, and 1 anesthesiologist. And you might wonder, well, why is the vet tech important? Well, the vet tech was important because they also are highly trained in veterinary medicine, but they're trained in the instruments used in the operating room. So somebody like that who's highly skilled, maybe in, we'll say, a sister field, was really, really useful to our team because the operating room nurse and the surgeon were able to train her on what we do in the pediatric OR, and that was really great for our team to have her there. So then I would like to move on to 2016, where this was a less clinical mission. So we called our project, it was me and another nurse, and we called our project Los Niños Saludables, and which essentially in Spanish means healthy children. And so we worked for the mayor of Sabaneta, and Sabaneta is a small suburb outside the major city of Medellin in Colombia. And they have their Department of Health and Social Welfare of Sabaneta. And so one of the things the government realized was that women were not going to further their education or not going to work because they weren't able to have childcare. So they created this program called Madres Comunitarias, which allowed mothers in the community to open up preschools and daycares in their home or in their community. And the government would give them money to help them do so. And they invested a lot of money in nutrition, so they developed a whole nutrition program. So what me and my colleague were set out to do was do assessments of the site. So we were doing needs assessments of each community site. And what we realized is that actually these children are really well cared for. Despite coming from areas of extreme poverty or homes that may have some intimate partner violence or substance abuse or early, some very young mothers, they actually were very well cared for in these preschools and daycares. And what we found was that these women that maybe only had a high school education, they just wanted more health information. They wanted resources, but there wasn't a place for them to go. So we created a pediatric health reference guide, and which I'll show you in just a bit. And that was really what they needed. And so then we kind of trained them to be health promoters, not only for the children they're caring for, but for the community. And so what these women would do is they would pick a topic from the book. They would meet sometimes twice a month, and they would decide on which topic they would then go back and talk to the women and the families and the men in their community about. And that was really, really helpful and really useful to them and something that they needed. So some of the action points that I covered already was that we visited and assessed the site. We hosted a health conference within the community members of Sabaneta. We presented our projects for the Office of the Mayor, and they got accepted, so they were able to use them even throughout the sites that we didn't visit and throughout the community. We had a clothes donation set up and a personal hygiene donation for children. We implemented a health class for children under 5 at one of the local, I guess you would say similar to what we have as a YMCA. They had a small children's after-school center that sometimes kids would be at and would play at. So we started offering them a health class, and then they will offer the health class in the absence of us and provide children with personal hygiene products such as soap and toothbrushes and combs. So we created and provided this pediatric health reference guide for the community centers. We trained local daycare employees to be health promoters in their communities. We donated condoms. We actually discovered that though condoms were very expensive to buy in small quantities, in this area of Columbia, if you buy 80 to 100 of them, it's actually very, very cheap. So schools were able to invest in buying larger amounts of condoms to distribute. And we created a family planning and reproductive health curriculum for high school classrooms and local adolescents. So it was to be used at the local high schools, but also at the Department of Health and Social Welfare Center, their site, or their community site, for adolescents that maybe are not in school or that have dropped out. We also created a proposal, was that we identified that there were high prevalence of teen pregnancy in the area, and that while the single mothers got a lot of support from the Department of Health and Social Welfare, the young men that were dropping out of school, there was no support for them. So we had an incoming intern, and we kind of handed him over the project, and we created this How to Grow a Gentleman, which essentially is just how to help young men that have dropped out of school move forward in their life, and how do we prevent young men from dropping out of school in the future. And it was a really nice project because this community specifically was having boys as young as 10 drop out of school. And so then we participated in a university fair for Sabaneta, in which we presented to an auditorium full of prospective college students, and that was really cool. So here's just an example. This is the introduction in Spanish. It just really says what the book is used for and what it's about. And here's an example. So this was the page we did on asthma. And when we were looking up resources, we discovered that despite hospitals and government sites stating that the references were for patients and for families, they were still really advanced. So we kind of simplified it, and we did the title. So here, this one's asthma, and we did the cause of asthma, the effect of asthma. We tried to include as many pictures as possible. And here we have the treatment. And then health, like this is promotion or health promotion. So how can you recognize the symptoms of asthma early? We have prevention here. How can you prevent asthma in the future? So like being around a lot of pets or maintaining a clean house. And then attention, we wanted to make sure, since this was going to be used at a daycare or preschool, what are things that a non-medical person needs to look out for an emergency? So if you have a preschool child that maybe is in some distress, what are some of those things that they need to look out for that are going to tell them, okay, we need to call for help, or we need to get this child to a hospital? And then the second book that we created was really a guide on healthy relationships, sexually transmitted diseases, so family planning, but more focusing on healthy sexual relationships among adolescents. And so this is an example of a page we have, I'll go back, of the first page of our curriculum or our reference guide that we provided to the local high schools and community centers, so that way the teachers can teach. And so here I have a picture of the model that we used. And so you can see myself, I'm in the black and white dress with the blonde hair in the first picture on the right, and my colleague is in the left with the black pants. And so we sat with a group of adolescent girls, and we had the girls read off each topic in each page and then had a question and answer. So it's not just about us teaching them, it's about them teaching each other from the information that we presented to them and allowing them to ask the hard questions. And we also did a condom demonstration and showed them some like how to use condoms, what condoms are used for. And so we mirrored this class for the boys as well. So that was something really important. And then so after Columbia, we moved on to a different project in Ecuador, partnered by Timmy Global Health. And this is where we completely switched gears, so where we went from community health promotion and curriculum development. We were in Ecuador doing pop-up clinics and working with the indigenous communities. And one of the really cool things about the USC MPH program is that you have such a diverse knowledge base to work from that you can do many different things with the same degree and many different things that you will love. It's not something that's limiting, and it's something that you can use in many different environments. And for me, coming from a nursing background, that was very important to find a program that was that gave me a really good knowledge base, so I can do something like community health promotion, but then I can also work with indigenous communities in the Andes Mountains. So one of the cool things about this project we did in Ecuador was with Timmy Global Health. They partner with universities, and I know recently they partnered with USC. They teach undergraduate and graduate students about the importance of global health, the importance of giving back, and so students will go through the coursework, and then they will go on a trip themselves. And so as a professional, it was 2 nurses, 4 primary care providers. Now they can either be emergency room providers or regular family practitioners, and 2 of those providers come from outside countries, and 2 of those providers come from Ecuador. So there's a really large teaching component here, and in addition, they have a local dentist and a local GYN. So it's a really nice collaborative effort. So as a nurse coming to this project for the first time, I had 18 pharmacy students with me. So this project specifically, or this week specifically, partnered with Butler University. I had 18 pharmacy students. We had local doctors. We had international doctors. And it was really nice to see everything sort of come together. And so our role as the nurse and as the public health professional was, we have 200 people at our doorstep that are coming for clinics. So how do we see the largest amount of patients and see the sickest patients, or the patients with the most needs, in such a short period of time? And so the top picture on the left is what the center looked like before we set it up. On the right, we have what it looks like from the outside. To the bottom left, these are all patients waiting to be seen. And to the bottom right, that's just a group of us. And so that's me on the right, and then 2 pharmacy students on the left, and the woman standing next to me is actually one of the community health promoters. And one of the really, really cool things that this program offered was that the community health promoters act as our translators, but they also ensure that the patients that we've referred or that require follow-up get follow-up in the local health center. So there's that accountability. So you can see how different my Gaza trip was to my Colombia trip to this Ecuador trip, and how having this degree really allows for many different types of opportunities. So now I'm going to move on to what I've done the last 6 months, which is work with Medical Teams International. And here we have some pictures of some of the work I did in Uganda. And I know that some of these pictures are hard for us to see, but as public health and global health professionals, we need to also realize that in the areas that we're working in, sometimes we're not really going to understand the gravity of the problem until you're there working within the community. And I will say for me, working in Uganda and focusing on capacity building, as you can see, I'm working with one of the nurse practitioners on the left, and we're doing newborn care, was really amazing. And having a degree with a focus on global health leadership kind of just builds, so you learn all these clinical skills, but how can you adapt your clinical skills in a refugee setting? How can you adapt your clinical skills to meet the needs of the general population? And so having a degree in public health really kind of brings that picture together for you. So here, my time in Uganda, on the right you can see that's a 2-year-old male who suffered from severe acute malnutrition. In the middle, on the top, we have some tropical ulcers. So those come from having, polymicrobial infections, and they need special treatments for and special wound care. And we have a burn just below it. So in one day, I could be working on newborn care to tropical infectious diseases or infectious medicine to burns and traumas to severe acute malnutrition. And having an understanding of the importance of all of those things is really important. So towards the end of my time in Uganda, we found that we were nearing the era of the new Ebola crisis. So one of the cool things that we got to do, me and another provider from the UK, was we developed a program design and a proposal to prevent possible Ebola crisis from coming across the border, or to at least identify it in a way that is safe when it does, if it were to come across the border. So that was really cool. And so lastly, I would like to talk about the work I did in Bangladesh. So I was in Bangladesh from July to November. And again, I was focusing on capacity building within the Rohingya community. And so we were capacity building with national nurses, so Bangladeshi nurses, that were working in clinics in this refugee camp. Now, one of the things about this refugee camp is that it's the largest refugee camp in the world. And so my first slide, when I asked, well, what do you do when 700,000 people come to your doorstep, this is kind of what it looks like. And so on the left, you have this man here that's sitting with the books. And so he was a community health worker that professionals have trained to go into the community, who he speaks English and speaks the local language, and he talks to the community about health concerns. But the true importance and the role of the community health worker became evident when they were having a diphtheria outbreak. And so remember that these people were displaced from their home, displaced from violence, so they're not easily trusting of outsiders. So having the community health worker can be a very positive bridge for you to build with the community, saying, hey, we have all these resources, but what's the best way that we can get these resources to the community? And so the organization trained over 181 community health workers to respond and to regularly provide sort of like a liaison between the clinic and the community. And so fairly early on, my focus was on sexual and gender-based violence, clinical management of rape, and gender-based violence programming. How can we adapt our programming needs to provide safe care for women in the community? And so that was kind of what ended up being my role there. So to summarize everything, what I've learned from the few places that I've been since becoming part of the USC family was that global public health is very complex. It involves many factors such as politics, health status, access to health care, religion, geography, socioeconomic status. I want to remind people that if you are a provider, don't work out of your scope of practice. So make sure that you understand what your scope of practice is in the place that you're working, and build on your skill set. So if your skill set is infectious disease, even if it's something as simple as teaching the community you're working in hand washing, remember that hand washing is something that saves lives in these communities. So you really want to build on the skill set that you already have. You want to be realistic about your goals. So short-term goals, measurable goals are ideal. So for example, me and my colleague were only in Colombia for 2 months. So what is a realistic need that we can meet while we're there for the 2 months? And so that realistic need was creating a pediatric health guide and a baseline curriculum for a family planning program for local high schools. That was something that was achievable and realistic. You don't want to make long-term plans for a community without handing it over to somebody or having somebody there that can follow through with these goals. And you always want to find out what the community needs first. A little funny story of something that I learned in Colombia was I met a woman who was getting her PhD, and she went to Colombia to study leafcutter ants in a village in the Amazon. And the community leader told her, while that is great, why don't you learn about something that is useful to this community? And I never forgot that, because since then she has not left that community, and she provided a toilet and a plumbing system for that small village based on the work she did through her PhD and how she was able to modify something to be what the community needs. So we always have to remember that sometimes it's not necessarily about us or what we want, because we're there to serve the community and learn from them as well. And always keep an open mind and an open heart. Sometimes certain things are very shocking to us at first, but listening is very important. So those are just some take-home messages. I'm going to pass this on to Genevieve, and I welcome any and all questions you guys have at the end.
All right. Thank you so much, Kate. That was really amazing. Your pictures are just astounding. Really enjoyed it, and I actually learned a little something too. So my name is Genevieve Kincaid. I am a physician in South Lake Tahoe. Currently, what I am doing is I'm a wilderness medicine physician. I'm also a research physician. I lead a few studies for the NIH and the CDC in Vietnam, but with my wilderness medicine, I do a lot of disaster relief. And I was asked to tell you what classes specifically helped me with my work that I'm doing currently. Pretty much every single one, every single class that I took. So what I'm going to talk about today is an experience, a humanitarian relief experience I recently had. I'm on the El Dorado County Search and Rescue Team, and as you all know, back in November, Paradise had a terrible fire, and the surrounding area also had a terrible fire. So I'm going to go through my experience And most of the pictures that are in this webinar are ones that I took myself. And if anyone has experienced this loss, my heart goes out to you. I look forward to your questions at the end, and let's get started. Okay, so this was one of the groups I was in when we were going through the Paradise Campfire site. I'll go over some facts in a few minutes. I have a lot of pictures. So the learning objectives for my talk is I want to review the facts surrounding the Paradise Campfire, discuss the role of CAL-OES, I'll go over what that actually means in a minute, discuss my particular involvement, and then discuss the health implications and impact of the Paradise Fire for civilians and responders. This is a video. You should all have a link somewhere of it's just one I pulled off of YouTube of the Paradise Fire as it was happening and some of my colleagues who were fighting it. So facts about the fire. It was located in Northern California in Butte County. The dates, the fire occurred basically from November 8th through November 25th, 2018. There was $16.5 billion of loss of property and other damages. Over 150,000 acres were burned. Almost 19,000 buildings were destroyed. We have approximately 86 to 88 civilians' lives were lost. We don't know the exact amount. There's still 3 or so missing. There were, as far as injuries are concerned, 12 civilians, 5 firefighters. The number is actually a lot higher. These are just the official numbers. The cause of the fire is still under investigation. This is just an image of one of the larger homes that was on fire. I did not take this one. This was from the AP and Noah Berger who took this picture. So I wanted to talk a little bit about the role of CAL-OES in the mutual aid system and the incident command system. CAL-OES is actually the California Governor's Office of Emergency Services. It's a cabinet-level agency responsible for overseeing and coordinating emergency preparedness, response, recovery, and also homeland security activities within the state. Because this was such a massive, devastating incident, the California Governor's Office activated everyone who was in search and rescue, police, fire, just tons and tons of people to come and respond to this this horrible event. This picture here is a group of us waiting for one of our morning briefings as far as what we're going to do. If any of you aren't familiar with the incident command system, this is a structure of how to coordinate large response, like disaster response teams. And if you go to the FEMA website, FEMA.gov, that's FEMA, you can learn all about incident command. You can take some very pertinent but dry classes or online classes. You can go to live classes. I recommend going to that. I've spent a lot of time working with FEMA on their incident command system. So basically you have one large leader and then it just trickles down into leader and a group and a leader and a group and leader and a group. So you'll see with the upcoming pictures that we have a lot of briefings. This is another briefing we had with a smaller group. And here's another briefing. That's actually me in the picture. Here's another briefing. This was the gentleman in the brown jacket. This is actually the deputy I work with search and rescue in El Dorado County. This is our smallest group briefing. Every morning that we were working, we would have maps set out where we would identify areas of interest. This would be where people may have still been missing, places that had not been searched. Fire might still be going on. We would go have drive-bys sometimes if we wanted to see if fires were still burning. So this was every morning we would actually look at these maps here. This is some of the transportation that we had. This is the inside of one of the transportation vehicles. A couple of my colleagues from El Dorado County on our way. This was one of the wealthy neighborhoods that we went through. As you can see, all that was left was brick. This is one of the retirement villages that we went through. Some of the surrounding woods. This was completely beautiful green woods before the fire happened. This was another home that was destroyed. The fire was so hot that it was burning glass and also aluminum. You would look at like your aluminum tires, aluminum wheels,
they would just be completely melted. Glass would be completely melted. And if you're not aware, like glass, I believe, melts at like 2,000 and 3,000 degrees Fahrenheit. There was a lot of news personnel in the area. This was a typewriter, actually, that we found that had been almost melted. Here was a truck that we found. A lot of the things that I saw looked completely like, just looked like a movie set. It was really surreal. So I'm going to be interspersing these slide sets with some kind of more upbeat things, just because this is a really serious topic and really serious experience that I had. But while we were there, it was really nice. The governor's office actually supplied all of us with a ton of food. This was on the left-hand side, this was 1 day of food. On the right-hand side, this is probably what you would get over 3 or 4 days of food. I still have some of the food that the California governor's office gave me in order to respond to this emergency. So everyone, look, there's NUTELLA. That was really psychological support for me personally. So what did I do specifically? Because I'm a physician, I was helping identify human remains. This is me at one of our sites digging through remains or through ashes, and I did actually find remains at this site. So what was I looking for? I was looking for pieces of bone. Unfortunately, due to the heat of the fire, the pieces of bones that we would sometimes find would be as small as an inch. How did I know they were bone? Well, bones kind of have what's called a spongy trabecular network. If you think about a sponge and you think about what it looks like, if it were dried, that's what we were looking for. We also looked for artificial devices that would have been in people, pacemaker wires, knee prosthetics, hip replacements. If we found what we thought was a human bone, we'd look for, if you know what a skeleton looks like, we would look for that pattern of bones, the way people would be lying or sitting or something like that. We looked for human ash, and I'll tell you how we did that in a few minutes, and also worked with forensic pathologists doing DNA testing. Now, I don't have any images. I just want to reassure everyone of remains that were found, but the images I do have that are coming up are a little disturbing, so I just want to give you all a warning. So what else I was doing, I was helping the teams identify common sites that we would find human remains. This was actually a trailer in the retirement village. This is a wheelchair found at a door. Fortunately, there were no human remains here, but that's one thing we would find and look for were quite a few wheelchairs in doorways. We would be looking in cars. People would try to leave paradise and get overwhelmed with the smoke. How did we know if a car had already been looked through? There's actually a method that the Federal Emergency Management Agency uses in order to communicate. There's an X on here. This was 4 points of communication showing that this vehicle had been thoroughly looked at multiple times. So this was really nice. We'd have this on buildings, on vehicles. We'd have it all over the place, these X's. We would just use typical like spray paint from a store. We also found remains in bedrooms. In the middle of the image, you'll see what looks like 2 bars. Those were bed rails. So that's where else we were looking. We also looked in tubs. That was pretty common, where we would find remains. We would sift through a lot of ash looking for pieces of bone. Here, specifically, we found ash on a mantle. This was probably from an urn, and we know that this was human ash, and I'll show you how in just a minute. So how did we know it was human ash, or we needed to look at an area even closer? We had human remain detection dogs that came from all over the country to help out. These dogs have been imprinted on human remains. There's anywhere from ash, bones, teeth, more recent, I would say, fresh tissues. These dogs are really, really amazing the way you train them. CARDA is the California Rescue Dog Association. They were the ones who supplied the most dogs for human remains detection. This was actually one of my colleagues and one of the dogs that we worked with. And I say one of my colleagues because here's another happy picture. This is my puppy KLAUS. He's now 20 months old. the German Shepherd. This is me again. I'm training him for human remains detection, also for search and rescue and avalanche. He's amazing. So with all the devastation that we came across, how did we cope? Well, we supported one another. This is one of my colleagues here. We would support one another. We would, we would joke around some just to kind of, try to like make people help each other get through it because it was pretty rough. Got a lot of exercise, and we all know what exercise does to the spirit. This is one of the colleagues I work with in El Dorado. This road here went on for miles. We actually just walked down it to go to a gentleman's homestead. But yeah, we got a lot of exercise with our colleagues. We found treasures that we would set out for returning residents. I did not take this picture, but I actually saw this nativity scene. So this nativity scene was recovered from the ashes, and we would set these out like on cars or in front of where the lots were. Here's some pictures that I took. On the left up here is a cup and like a Christmas dish and a couple more cups. We could set these out. This Christmas dish, unfortunately, was broken. I did find one really special Christmas cup that I set out, but I didn't take a picture of that. This is a figurine on the bottom left-hand side that we found and we set out. We found a stocking and put it on the person's chimney, a rocking chair, and also a bicycle, perfectly intact. It was really amazing how you would see like nothing but devastation and just something perfectly intact that didn't even, get ruined. But this kind of helped us cope as well. We showered together, and that's how we coped. It's not what you think, actually. We had required decontamination. I'll go over some of the chemicals that we were exposed to in a few minutes. But the United States Marine Corps and the Army, they had a whole bunch of people running our decon showers. So here's an inside of the decon shower with a couple of my colleagues, and here are a couple of the Marines who were helping spray us off. Yes, we had to decontaminate our clothing and our shoes, our hair, everything. We also slept together. And would throw things at people if they were snoring too much. My advice for you, if any of you go out and do disaster relief, you'll probably be sleeping in a big giant room. Take earplugs, please. So after the fire is out. So why am I talking about this? Because I'm a physician, not only was I doing the human remains detection, I'm also very concerned about occupational and environmental exposures. That has a lot to do with the research I do at the NIH and the CDC. So besides a little small, I do apologize, but I want to talk a little bit about the health implications for civilians. For the acute or very recent things that would happen to people, with the smoke exposure, they would have respiratory problems, so there would be asthma exacerbation, there'd be a lot of increased mucus production, they'd experience headaches, runny nose, chest pain. People who had cardiac issues were experiencing chest pain because their heart wasn't getting oxygen the way they needed to. You'd get dizzy, obviously. If any of you have ever been around a campfire and you start breathing in smoke too much, we're all going to get dizzy. Our brains need oxygen, not smoke. A lot of people were had experienced or were experiencing acute stress disorder, which is a kind of a shortened form of PTSD. It's that kind of immediate shock of, oh my gosh, my life is at risk, or I've lost everything. They were also exposed to a lot of metals and organics. This would be in everything that was burned down, with all the buildings and the trees and the vehicles, and there's just a lot of stuff that they were exposed to. As far as chronic health implications for civilians, there are increased risk of heart and lung disease, COPD, asthma, atherosclerosis, that's like the plaque buildup in your arteries that can cause heart issues, post-traumatic stress disorder, of course, loss of possession, security, and finances. I'm not sure if people are aware, just to kind of sidetrack for a minute, after 9/11, there was a lot of premature births, so that's another thing that we have to be aware of when people are exposed to a lot of smoke, a lot of fire, a lot of material waste that's been burnt, that can also affect women who are pregnant. I'm very concerned about the health implications for our firefighters and mutual aid responders, because not only do we experience all of the acute things because we're there, putting out fires, sifting through the burnt rubble, the burnt buildings and everything, but we also get exposed to carbon monoxide, benzene, sulfur dioxide, lead paints, metals, organics, other particulates. Long term, we experience the same things as the civilians, but there's a lot more cancer in firefighters, police officers, and mutual aid responders due to the fact that we would just be on our hands and knees digging through things. We would be fighting fires and experiencing, breathing in the smoke. Even if you had a respirator on, you still were exposed to so much. So what does this mean? We definitely need some studies to follow people exposed to chemicals of the Paradise Fire, and either I or someone else is going to try to set up a longitudinal study just to follow some of our health responders and civilians who've been exposed to this fire, just because I know that there's going to be long-term health implications. Why do I keep doing this? Well, this is another video that you should all hopefully have a link to. If you go to YouTube, you can just look at lost cat timber found in the Paradise Fire, and this is just a really sweet video of timber reuniting with his or her owners at the fire site at their house. It'll make you cry. So this is me, last picture that I wanted to show at one of the sites. Basically, there was nothing, and here's me in my garb. So there's my email. If any of you have any questions, I'm also on Instagram, Genevieve Kincaid. So there's more pictures of my Paradise experience there. But I'd love to take your questions, and I'm going to pass it on to Kiana.
Thank you so much, Genevieve and Kate. We will now try to answer your questions. Again, to submit a question, please type it in the Q&A box and hit send. It's so great to hear from students about, their experiences in the program, and more importantly, how they've applied what they learned in the program in their careers. And I want to actually start with this first question that goes to both Kate and Genevieve. You can answer it in that order. This is from Matthew Sobo. Both of you have been a part of such powerful events and played very pivotal roles. So can you please discuss how the MPH online program at USC and your education and experiences acquired through this program prepared you for these real-world events?
Yes, I'm happy to answer this question. And I will also answer the question right after it in the same answer, if that's okay?
Sure.
Great. So the second question from Matthew Smith says, I've heard a ton about the Trojan Network. Are you both a part of the network, and are you able to share any experiences? And so the reason why I'm reading this question is because the first question asks about how the USC online program prepares you for real-world events. So I will say that there is no program on this earth that will ever prepare somebody to deal with things like mass rape or devastating fires. With that said, the USC MPH online program and the Trojan Network does provide you with a strong network of people, well-educated, experienced people, to help you learn how to manage those events. But also, if I ever came back from the field and was like, hey, I just spent 6 months working with women, with 300 women, 200 women that are all living in a culture of intimate partner violence, and I don't know how to deal with that, the Trojan Network allows you for a space to connect the dots, to get support from your colleagues. Or if I was saying I'm working on this project and things just aren't working with the project, do you have any advice? It provides you with that support system to help you with those events. And I'm not sure if that answers your question, Matthew and Matthew. But there isn't a program that can ever prepare you for certain things. So it's more about, does the program offer you that Trojan network, that network of people that you can go to? And I could maybe have not spoken to anybody from the Trojan Network in a year, but I always know that I can email people from the program, I can email administrators from the program, ask them for advice, ask them for support, and I'll have guidance. And that, to me, is why I chose the program when I was looking for what program would be best for me.
So sorry, Kate.
No, that's okay. Jen, you can go. Yeah.
Yeah, I absolutely agree. There is no program that can help prepare you for something like mass rape or like a devastating fire. But I actually found a lot of the classes when we talked about like the structure of responding to like community events or, you know, disaster response, it really gave me that background knowledge of, it's like I knew what to expect as far as like the structure was concerned. As far as communicating with people all over, I would say even like all over the state, all over the world, easy because of what I had with like USC, just being able to, doing the online program and communicating with people everywhere, learning how to deal with like different cultures and different time zones and different expectations really helped me quite a bit. And as far as the Trojan Network is concerned, hands down, 100%, I still contact people. And like Kate said, it can be a year. I mean, I'm friends with people. Like, we would meet up and we will have coffee occasionally. You know, I'll go to, you know, APHA conferences and still see people. And it's just like, anytime you see anyone, even in the Paradise Fire, you see someone who's got like a USC like sweatshirt or something, you're like, hey, you know, fight on, right? And it just automatically, you have this amazing bond, and there's so many people and so many resources. And if anyone's interested in disaster work, you can talk to Shubha. That's Dr. Kumar. It's really, really amazing. Like, just the resources, they're like, hey, you know, I want to do this project, or I need this resource, or I want to get students involved. And it's like every single time I send an email, I'd have to say within 24 hours, if not sooner, someone has responded to me. And I've been in school for a very long time. You saw I have a few letters after my name, and USC is probably one of the very like best schools I've ever attended. And this it's just amazing. And like, I want them, I keep pushing for a PhD program that's online. So just letting you know, Kiana and Shubha, if you ever have a PhD program.
I'll second for that PhD program online. So you guys can work on that. That'd be
right. And I'll tell you, we're working on it.
Sign me up. Just go ahead and say, you know, Jen Kincaid will be one of the students. I don't even care what it is. As long as it's with you guys, I'm one of the students. So.
Oh, thank you. Well, we would love to have you if this materializes.
Absolutely. Yeah. Absolutely. Well, thank you guys for answering those that question, or those two questions, because Genevieve did speak to a little bit about the Trojan Network as well. Our next question I would actually like to direct to Dr. Kumar. This is Allison Navarro. She states that I personally want to do something along the corporate wellness guidelines, and I was wondering how USC could assist me in achieving this. It seems like a majority of the focus in this particular seminar is on global health, so just wanted to know what program USC has in this department. So maybe speaking a little bit to the concentrations.
Sure. It's a great question. So we offer, in addition to global health concentration, we offer a concentration in community health, and that may be the one you're more interested in as far as looking at domestic health issues. And the courses in that track include a course on public health communications, implementation of public health programs, I believe culture and health, so really more domestic and community health focused. And there's an opportunity to investigate programs of your interest, so if that's in the corporate wellness space, or for instance, diabetes in, you know, population X space. In the courses, you have an opportunity to kind of dig deep into the areas that you're interested in. With respect to wellness, corporate wellness, actually, funny enough, I've worked on research in that area along with one of our other faculty, Heather Whipsley. And so faculty are often doing research in these types of areas, and that will come out in the courses. So I would go ahead and take a look at the community health concentration and the types of research that our faculty are doing, and you will likely find things of your interest.
Great. Thank you so much for answering that. And I'd actually like to direct this next question to you as well, Dr. Kumar. What steps are taken and what resources are available to help prospective students in determining which concentration is best suited for the student's interests before entering the program, considering the concentrations seem to blend together quite a bit, as the presenters have pointed out?
Sure. So, there's information that you can read about in terms of, on our website and when you meet with Jessica for your orientation call. But also, you don't have to solidify which track you want to do until you're at least 2 semesters into the program. So sometimes that changes for students based on the first, set of core courses you're taking. You might realize that you're more interested in particular ones than others. We also, every student has not only, the overall student affairs advisor, who's Jessica, who's there to kind of answer questions and help with tracks, but we also have an academic advisor who you can speak to get more depth about the different tracks. And then, of course, each student is also assigned a faculty mentor that they work with throughout their duration in the program. And you can always speak to the track directors, the faculty track directors. So there's a lot of resources in terms of speaking to different folks about what tracks you may want to pursue. And again, you have basically up until at least the second semester of the program to really make a decision on that. And
every faculty person that I came across, every single class that I had, every single person I interacted with at USC, it was shocking. I liked, and not just liked, I respected, and they were so incredibly helpful. My dad passed away when I was in the program, and it was really great how much they support you.
All right. Sorry, go ahead, Kima.
Oh, I didn't know. Was Kate going to answer that as well? Did you want to chime in?
No?
I
would have to agree with what Genevieve said. When I had planned to do my Gaza mission trip, I was well into the semester nearing midterms. And my professor just kind of opened it up to the class and was like, hey, Kate's doing this really awesome thing and we all need to support her through it. And that was really awesome for me, to have somebody believe in me while I'm working full-time and trying to still give back to the Globe community. And they just accommodated it, and that was really awesome.
Wonderful. Thank you so much, guys, for answering that question. Our next question is, what were your biggest highlights from the MPH program? How were the class schedules, and did you connect with classmates outside of the online class? I'd like for both young ladies to answer. If Kate can answer first, and Genevieve, if you can follow.
For me, so this is Kate speaking, I have so many highlights. I think the coolest thing for me, which was something I answered in one of the Q&As here on the computer, but I'll give you an example. So one of my classmates, Alan, is one of the most brilliant men I've ever met, and he loves statistics, especially biostats, and loved epidemiology. And we worked really well together as a team. And I think it was just really cool to be in a group of people that in some ways are like-minded, but have very different professional backgrounds, have maybe come from different places. There was people that were coming from other countries that were also participating in the course. So kind of learning from each other, but also team dynamics is not something that's easy to learn right away, and it was a really cool way to learn how to work together as a team just by working on these projects. And the funnest thing is that most of the time the professors were like, whatever you want your project to be on, you have, let's just say infectious disease would be the large topic. You get to kind of choose a little bit. So for the first time, you're guiding your own education and enjoying it at the same time. And that, for me, was really important. So that was kind of one of the highlights, I think, was the working on a diverse team.
Okay,
Right.
Genevieve?
Oh, yeah. Okay, sorry. As far as how the class schedules were, you know, I worked full-time and took 2 classes a semester. Some people will only take 1, and I felt like it was really, really reasonable. I lived on the East Coast at the time, so most of my classes were pretty late. I live on, you know, on the West Coast now. But, you know, I think it was like maybe 1 day a week that I really had to devote to if we had a live online class. And did I connect with my classmates outside of online class? Yes. The first time I actually met them was at an APHA conference, and I'd only seen their faces like postage stamp size, and it was just really fun getting together at one of our socials and just saying, hey, you know, I've only seen your face the size of a postage stamp, and it's just because we bonded. I mean, you spend a lot of time working with a team, and I really think that this program, if anyone's interested in doing any type of like long-distance communication, especially if you're going to go into global health or even in the communities, if you have to, you know, communicate with someone, you know, just a county away, being able to effectively communicate through different media online is super helpful. And I'm still in touch with quite a few people that I did my online classes with. I mean, you know, visiting people. I'll be in Utah. I'm really sad. One of my friends now he's in Washington, and I don't get to see him this time, but, you know, we all got together and a big group of us got together for graduation. Like, we all came from around the country just so we could be together for graduation in Los Angeles. So that was just really special, too.
Yeah, and I would like to second that the graduation for me was the same. It was really special to also be able to, like, share that moment with people. And for me, so I worked full-time and did my MPH online full-time. And while I wouldn't say that's something I would like highly recommend to others, it was manageable for me. The only time it really became difficult was when I had to do my practicum. You know, because you're working full-time, you're going to school full-time, and you have to do these internship hours. So I would say that semester for me was really about giving like my whole self to my education and the internship as well as my job. Whereas the rest of the other semesters were easier to manage with my work schedule. So I hope that I don't want to say that this program is easy by any means. It was definitely had its challenges, but I always felt supported through those challenges, which is cool. It was a nice feeling at graduation, I will say, like when you work full-time and you're in school full-time, and then to be there with your colleagues, it felt good.
Absolutely.
Wonderful.
You know, I did take time off for my practicum, but the cool thing is with my work, because I do so much research with the CDC and the NIH, I actually combined that work with my practicum and was able to expand on the work and have published a few times now. So that was really fun. And the work directly that I did during my practicum was able to be published. So, which is cool. That was really fun.
Wonderful. Thank you, ladies, for answering that question. I'd like to ask another question. This one is directed to Dr. Kumar. Does the school offer resources to potential internships or jobs post-graduation?
Yes, we definitely do. So we have a listserv that goes out constantly with internships, job postings. We have a career fair that we put on. There's a dedicated career counselor that works with our students for the MPH online program. So you've got lots of resources to work with you in that space. And as well as our capstone course, which comes towards the end of the program, also involves some professional development activities and mentoring. For the sake of time, I'm also going to go ahead and answer a few other questions I see in the chat box because I see we're a little over. So another question from Matthews, are all on-campus resources available to students enrolled in the MPH online program? Yes, I would say most on-campus resources are available. So you're certainly, for those of you who live in the local area, you're welcome to come to campus to attend any of the events that we have with speakers, to meet with any faculty in person, with your TAs, et cetera. And there are, online resources available to help with, writing resources and others. So yes, for the most part, the resources are available to students?
I accessed the psychological services when my dad died through USC. So yes, I would say pretty much probably everything that I needed. There has not been a single thing that I needed from USC that I wasn't able to access.
Great, thank you for speaking to your experience directly. Another question from Melissa. So online master's program can still have a stigma of not being accredited as you would in a traditional classroom setting. From your experience, have you had any trouble with employers? Well, I will direct that back to the students. Jen,
no, none. So our diplomas do not say online. In fact, when I tell people, you know, it's an online kind of executive style program, they're like, that's the greatest thing ever, because we're trying to we're trying to set up our own kind of like distance program with such and such. Can you help us with that? And then, I mean, I'm my own boss now, so I don't have any problems with myself, so which is really great. And I fully credit the master's program to helping me like figure out what I needed to do to run research studies and to run organizations and, you know, run my own businesses. So, I mean, you don't just learn the public health stuff. You learn a lot of like human business, like kind of relations, and just structurally, you know, how to organize things and how to build things and how to evaluate them. You know, develop, implement, plan. Or that, not in that order, but I'm sure Kate remembers those things: implementation, planning, development, evaluation, all that stuff.
Yeah, I would have to say I would agree. I don't think the degree says USC, so really the question only comes up when they see my resume and see that during the time of my degree I didn't live in Los Angeles. But at that point, if they're requiring an MPH for any type of job or assignment, they see USC and they're like, oh, you went to a really good school. Like, they're more impressed by USC. They don't even really ask about the online portion. But also I will say that USC is one of the few schools where, or the few schools that I know of, where students that are sitting in the class get a very similar experience to the ones that are online, because it's the same professors. A lot of the same professors are teaching or have taught both courses. And the way that the program is designed, for me, if anything, felt a little bit like more work than going and sitting in class. But for me, it didn't feel any different, because you do have scheduled time with your professor and your other classmates via webcam every week for each course. So there weren't, I don't think, nobody really cared. That's really, I guess, the short answer.
Especially with USC. I mean, it's such a USC has got an amazing reputation. They're just one of the finest institutions in the country. So really, like Kate said, people see USC and they say, oh, okay, good, you're hired. You know, I mean, really, that was my experience. So.
Wonderful. Well, I want to thank our speakers, Kate McAvoy, Genevieve Kincaid, and Dr. Kumar, and everyone who participated in today's webinar. A copy of this recording and slide presentation will be available shortly after. If you have any additional questions, please feel free to reach out to an admissions advisor. Our contact information is listed on the screen. This concludes today's webinar. Thank you again, everyone, and have a wonderful rest of the day. Bye-bye.